Hello everyone, and welcome to this audio podcast. This audio podcast is part of this chapter, the ShiZMode Chapter. This audio podcast is part of Shitstorm Panzer. This audio podcast is part of the analysis and expose and lobostics. This audio podcast is part of the Geronimo, and this audio podcast as part of a Storm Lobostics production. And through this audio podcast, I look at the underlying sort of basis in and around polypharmacy. So polypharmacy are definitions or bases and relating to overprescribing of particular forms of treatments, for example, have been highlighted in amongst literature aligned to different conditions. Polypharmacy itself also polypharmacy itself refers to the use of multiple medicines, and is commonly is a sort of evidenced in amongst the literature in the majority and amongst those of the elderly population. However, that being said, there is literature to inform that polypharmacy is and can be important in amongst children and young people with multiple conditions or multiple conditions aligned to health aspects of healthcare. And so the multi-morbidity conditions may be treated by one or more medicines for each sort of condition. Morbidity is also associated with decreased QOL or quality of life, as well as increases in mortality, hospitalizations, and also treatment costs. At the same time, early intervention and the importance of assessment or risk assessment and prevention is important or pertinent in the care for example, care in amongst nursing and care home populations. The National Institute of Health and Care National Institute for Health and Care Excellence, or NICE, guidelines have been aimed at primary care teams. The recommendations aim to address known and unacceptable variations in recognition, assessment, and initial treatment or treatment modalities in as part of referral to point of care testing or screening, and aligned to where there is a suspect or high risk for example particular conditions. The inpatient mortality in around for example where for example renal insufficiency varies considerably depending on the severity and setting, for example intensive care or not, and many many healthcare service user relating factors. But in the UK at the same time, this might be typically between 25 to 30% or more. In view of the frequency and mortality rate, prevention and amelioration of just around 20%, for example, of cases where there are suspect or high risk for renal insufficiency or impairment, would actually prevent many deaths and substantially sort of reduce complications and associated and aspects aligned to associated costs. That draws this audio podcast to a close. The next audio podcast, as part of this chapter, will look at sort of the aims and objectives. So, audio podcast as part of the ShiZMode chapter. This audio podcast as part of the shitstorm Panzer. This audio podcast as part of the analysis and expose lobostics, and this audio podcast as part of the Geronimo and a Storm Lobostics production.